Good morning, everyone. Welcome to Dallas County Health and Human Services webinar series. My name is Marissa Gonzalez, public health educator. If this is your first time participating in our webinar series, I would like to personally welcome you to our webinar. And if you're returning, welcome back. We're so excited to have you with us today. We'd also like to welcome our live audience that is here with us this morning. We've got some great information about the upcoming flu season in Dallas County that we can't wait to share with you, so you can share with others. If you're here with us via the web and you have any questions, please type them into the text box to the right of your screen and we will answer them at the end of the presentation. If you're part of our live audience, you will have an opportunity to ask questions after we complete the webinar. Just a reminder, we kindly request that you place your phones on mute to avoid any background noise as we are recording this live. This webinar will be posted to our website. If you want to hear it again or if you'd like to share it with others, please do so. We also have our materials, flu materials, that are also on our website for you to distribute on your website, social media, or as handouts for literature. And don't forget to sign up for our digital updates so you can stay up to date on the flu virus and other public health issues. Just go to www.dallascounty.org/HHS and click that red envelope in the upper right-hand corner of the page to receive text messages and or email alerts. You can also follow us on Facebook, Dallas County Health and Human Services, and we're also on Twitter at DCHHS. And now I'd like to introduce to you Ganesh Shivameyer, Interim Director of Dallas County Health and Human Services. He would like to welcome all of the participants today. Director Shivameyer.
Thank you, Ms. Gonzalez, and good morning to all. I would like to welcome everyone who has joined us on this live broadcast and also those listening to us on the recorded version of this webinar. Part of the department's emphasis this year has been to form partnerships and collaborations in the community. One of the responsibilities of public health departments is to educate the public on important health matters, and this is not wholly possible without the participation of your agencies in these endeavors. If your organization has been selected to participate in this webinar, then you are considered a vital part of the system that bridges our efforts with communities at large. I urge you to please share this webinar with members of your organizations. Again, thank you for being a partner in this process to protect the health and safety of residents of this county. Now over to Health Educator Gonzalez.
Thank you, Director Shivameyer. And now I'd like to introduce you to Q Shim, Epidemiology Surveillance Coordinator. Q will present about the Dallas County flu data. Q?
Thank you. Influenza strikes our communities every year, taking its toll in illnesses and deaths. I'm going to start this webinar by providing a brief overview of our health department's flu surveillance program. Public health partner agencies, such as the Centers for Disease Control and state health agencies, track flu activity every season on national and regional levels. Our department also collects local flu data to look at its impact within our county. We collect flu data from 4 sources: area hospitals, laboratories, schools, and the medical examiner's office. These sources provide 5 categories of information: numbers of positive flu tests, numbers of persons visiting emergency rooms for flu-like illnesses, numbers of school absences from flu, and numbers of hospitalizations and deaths due to influenza. You can see here on this slide the website link where you can access the weekly report, which we put together to summarize this data and feed the information back to our community partners and to the general public. This information helps to provide healthcare providers, schools, and businesses with up-to-date awareness of the timing and severity of influenza activity in our area. This slide shows the flu positive tests reported to our health department by 14 hospitals in our county during the 2017-18 season. We use this data to determine both the timing and the intensity of flu activity. As you can see from the graph, this flu season began picking up in October and peaked in late December when about 30% of tests for flu were actually positive for the virus. Also shown on this graph is information about the types of flu viruses which circulate. Overall, in a season, influenza A viruses are reported more frequently than influenza B viruses. The proportion of type B viruses increased towards the end of the flu season. This type of information about the timing of the flu season helps our hospitals to know when to implement seasonal policies for their employees and visitors to better protect their patients from flu. This data also helps schools to know when to send out reminders about flu prevention messages to parents to help reduce flu illnesses in our schools. This slide shows the number of patients admitted to intensive care units for influenza in our county over the past 5 years. The 2017-2018 season had the highest total numbers of ICU hospitalizations due to flu, which means that this was a severe flu season. Nationally, the CDC described the 2017-2018 season as the only season since 2003 to be classified as high severity across all age groups. Tracking the local numbers of ICU hospitalizations helps our hospitals to plan for increased needs for special equipment and staffing to care for patients who are critically ill with flu. Another marker of the severity of a flu season is the number of flu-related deaths. This slide shows that during the 2017-2018 season, over 80 deaths from flu were reported in Dallas County. This was the highest number in more than 6 years. Flu deaths were most common in older adults and in persons with chronic medical conditions. This highlights the need for flu prevention messages and treatment recommendations to reach these high-risk populations. Thank you.
Thank you, Q. Very good information. And again, if you want to get those flu reports, make sure you go to our homepage and sign up for those alerts so you can stay in the know. And now I'd like to introduce Public Health Authority Medical Director, Dr. Christopher Perkins. Dr. Perkins will discuss flu severity, signs, and symptoms. Dr. Perkins?
Thank you, Health Educator Gonzalez. Good morning to everyone. Last flu season was severe. However, seasonal flu is often unpredictable in its intensity and severity from season to season. What we do know in public health that there is going to be a flu outbreak of some sort. Therefore, there are actions we as a community can take to protect ourselves and our neighbors. The official flu season in Dallas County starts in the early fall of the current year and extends into the late spring of the following year, which means this flu season starts this October 1st, 2018, and extends through May 31st of 2019. The CDC recommends annual influenza vaccination for everyone 6 months and older with any licensed, age-appropriate flu vaccine with no preference expressed for any one vaccine over the other. The flu can be fatal, especially for seniors. Approximately 90% of flu-related deaths occur in people aged 65 and older. This slide here is a snapshot of our surveillance report that is issued on a weekly basis during the flu season. As far as the Texas Health and Safety Code, it is mandated that medical providers, being nurses, physicians, hospitals, laboratories, that they report confirmed diagnostic lab results of flu to the local health department. That is only required as it relates to pediatric deaths. As far as adult deaths in Dallas County, we have been proactive where we report those as well to give us a better indicator of the severity of any given flu season. Let's talk about signs and symptoms of seasonal flu. Flu can cause mild to severe illness, at times can lead to death. People with flu are most contagious in the first 3 to 4 days after their illness begins. Not everyone with flu will have fever. Other symptoms that one can experience one way or the other, or most experience, you might experience cough, sore throat, runny or stuffy nose, muscle aches, body aches, headaches, fatigue. Some people may experience vomiting and diarrhea, though this is more common in children than adults. Most people who get flu recover in a few days to less than 2 weeks, but some people will develop complications such as pneumonia as a result of the flu, some which can be life-threatening and result in death. Sinus and ear infections are examples of moderate complications for flu, while pneumonia is a serious flu complication that can result from either influenza virus infection alone or from co-infection of flu virus and bacteria. Other possible serious complications triggered by the flu can result in inflammation of the heart, brain, muscle, and other multi-organ failure can result, such as respiratory or lung failure and also kidney failure. Flu virus infection can trigger respiratory situation. If you're previously an asthmatic individual, it can worsen your asthma. Also, if you have heart disease, it can result in increased stress to your heart. So people at high risk from flu, anyone who can get sick with the flu, even healthy people, and serious problems related to flu can happen at any age. But some people at the highest risk for developing serious flu complications if they get sick are going to be those over the age of 65, people with any underlying chronic medical conditions, such as I previously mentioned, asthma, those with diabetes, heart disease, pregnant women, and children younger than 5 years of age, especially younger than 2 years of age, are at increased risk for developing complications from the flu. Let's look at the flu vaccine recommendations for this common season. The best way to protect yourself from the flu is to get the annual flu vaccine. It is first and best available way to protect yourself and your family from flu and its potentially serious complications. Flu vaccination can reduce flu illnesses, doctor visits, missed work and school due to flu, as well as prevent flu-related hospitalizations. It takes about 2 weeks after you receive your vaccination for your body to develop the antibodies to protect yourself against the circulating flu. So make plans to get your vaccine early. Get your vaccine now before the flu season begins. Options for this season, we have several variants of the vaccine, but the main thing for it to be effective that you get your dose. Thank you.
Thank you, Dr. Perkins. Wonderful information. All right, now we are going to have Director Shivemeyer talk about the impact of flu in the workplace, productivity, and the economic burden in the workplace. Director Shivemeyer?
Thank you, Ms. Gonzalez. This slide will focus on the impact of flu as it relates to total economic burden and productivity. Essentially, this pertains to organizations of various sizes that employ people. Economic burden is a combination of higher medical costs and money lost due to reduced productivity. Each year, an average of 5 to 20% of the US population gets the flu. Tens of thousands are hospitalized, and worse yet, thousands die from flu-related illnesses. The CDC Foundation estimates that there are 31.4 million outpatient visits annually due to flu. Additionally, there are approximately 200,000 flu-related hospitalizations costing roughly $10.4 billion annually in direct medical expenses. Aside from this, based on a study, a new Walgreens report suggests that the US adults missed 230 million workdays, costing employees $30.4 billion annually due to flu-related illnesses. Lost productivity affects both the employees when sick leave is uncompensated and businesses where sick time is employer paid. In addition, according to a study and survey projections conducted by Walgreens, it was estimated that approximately 6.2 million business trips annually were canceled last season, resulting in additional losses to businesses both in monetary terms as well as productivity. When you add all this up, flu results in more than $87 billion annually in total economic burden, according to figures published by the CDC Foundation. What can employers do to protect their workforce and mitigate losses resulting from flu? Employers may adopt the following strategies to prevent the flu and prevent the spread of flu. Encourage employees to get the flu shot, or better yet, consider offering the flu shot to employees at no cost. Vaccination is the single best way to prevent flu. Number 2, emphasize workplace hygiene by posting hand washing signs throughout the facility. Employers may communicate to employees the importance of staying home when employees come down with flu-like symptoms. Adhering to proper cleaning, disinfecting, and sanitation standards as it pertains to the workspaces, objects, and hotspots around the facility that tend to be hosts for virus and bacteria. Remember, cleaning and disinfecting are part of a broad approach to preventing spread of disease. And most importantly, employers should educate employees about flu prevention through flyers and electronic media such as websites and social media. With that, I would like to hand this back to Ms. Gonzalez.
Thank you, Director Shivameyer. Also, I want to remind you, if you have any questions, go ahead and start typing in your questions in the text bar to the right of your screen, and we will address them at the end of the webinar. And I'd also want to go over the flu prevention reminders. So an ounce of prevention is worth a pound of cure. It's a lot easier to prevent than it is to treat. CDC recommends a yearly flu vaccine as the first and foremost important step in protecting against influenza and potentially serious complications. It's important to take everyday preventive actions to stop the spread of germs. So some of the things that we recommend is to avoid close contact with sick people. You don't want to be around people that are sick. Also, while sick, limit contact with others as much as possible because you don't want to spread your germs onto other people. And if you're sick, please stay home for at least 24 hours after your fever is gone, except if you have to take yourself to the doctor. But you need that rest. Also, when you cough or sneeze, do that in a tissue or in the bend of your elbow to prevent spreading germs. Wash your hands frequently with warm water and soap for at least 20 seconds. So sing happy birthday to yourself twice. If soap and water are not available, use an alcohol-based hand sanitizer. Of course, water and soap is best, but if you don't have that, the alcohol-based hand sanitizer is a good alternative. Also, avoid touching your eyes, nose, or mouth. This is how germs spread. And don't share personal objects like eating utensils, toothbrushes, or towels while sick. Clean and disinfect surfaces and objects that may be contaminated with germs like flu. There are antiviral medications that are out there. So if you get sick with the flu, the antiviral drugs can be used to treat your illness. These shorten the duration of the flu symptoms, making them milder. It may also prevent serious flu complications. This is particularly important for people who have chronic medical conditions such as asthma or diabetes. And while there is no cure for the flu virus, we can treat the symptoms. And the things that we recommend is to get plenty of rest. So stay home. Drink plenty of fluids to stay hydrated. And you can take over-the-counter medications to reduce fever, aches, and pains. And if your symptoms worsen, please see your doctor. Now I'd like to talk about persons that are at greater risk for severe illness from flu. So adults that are 65 years of age or older Immune systems become weaker, and high-risk flu-related complications can become serious. 70 to 85% of flu-related deaths in the U.S. have occurred among people 65 years and older. There are 2 vaccine options: a high-dose flu vaccine that contains 4 times the amount of antigen as a regular flu shot. This creates a stronger immune response. And the adjuvanted vaccine, which is the standard flu dose. It's important to begin antiviral medication as soon as your fever develops, especially with persons that are at greater risk for severe illness. Also, people who have medical conditions such as asthma, chronic heart or lung disease, blood disorders such as sickle cell disease, diabetes, or weakened immune systems, persons with HIV, AIDS, or cancer patients. And even if well managed, this still places people at high risk of serious flu complications. Pregnant women are also at greater risk for severe illness from the flu. They're more prone to severe illness from the flu, including illness resulting in hospitalization. This can also be harmful for a pregnant woman's developing baby. And again, getting vaccinated can also help protect a baby after birth from the flu, as the mom passes antibodies onto the developing baby during pregnancy. And to conclude, if you can take 3 actions to fight the flu, that first one, like we said, is to get that flu vaccine every year. Stop the spread of germs, making sure that you wash your hands, blowing your nose or coughing in a tissue or in the bend of your elbow, also disinfecting any hard surfaces, and taking those antiviral drugs if your doctor prescribes them to you. And now we will begin our Q&A session. If anybody has typed in any questions, we will certainly address those at this time. Okay, so we're going to go ahead and answer these questions. All right, the first one is, when should I get vaccinated? I'm going to hand that question to Dr. Perkins.
Thank you. The vaccine is available at various locations throughout Dallas County. First, here at the health department, as well as your neighborhood pharmacies. No preference indicated here, but for example, Walmart, Walgreens, CVS, etc. Also at your doctors or your primary care providers' offices. And of course, they're available at the hospital if for whatever reason you might be hospitalized, before you get discharged, you might inquire about getting the flu shot.
Very good, thank you. Okay, and for our second question, can I get a flu vaccine if I'm allergic to eggs? Dr. Perkins?
Yes, you can. People who have experienced hives after receiving a previous flu vaccine can get a subsequent vaccine of flu. There are some combinations of the vaccine that's not made with the egg, so there are other options. If you had a mild reaction and even moderate, and if what your doctor has or your provider only has the egg base, then you can still receive that dose under a medical supervision, so we can watch you. However, there are no excuses. First and foremost, the best line of defense against the flu is to get the flu vaccine. So talk it over with your provider and then move in that direction to make sure that you protect yourself and loved ones for this long season ahead of us.
Okay, and then the third question here is, are other hospitals finding difficulty obtaining flu vaccines for employees?
I'll answer that. As far as current information that are available that I'm aware of, that is not an issue at this time. So definitely check with your employer, your hospital. Also, we have other options, as I clearly indicated, where you can seek out the vaccine. As a matter of fact, you can search online as far as based on your zip code, and it'll reveal the availability of the vaccine from various resources in your nearby neighborhood.
Okay, thank you, Dr. Perkins. We're going to go on to the fourth question here. When is the flu vaccine available, and which types of vaccines are available, such as senior, adult, children, and what is the cost?
The vaccines are available. However, the cost, that will be something that most is covered by insurance, by Medicare, Medicaid, CHIPS, etc. So talk that up with your provider, with your employer, and by all means, get that flu shot. The vaccine is available now, by the way. So go out and get it today. Come here at the Dallas County Health and Human Services and receive it today.
Very good. Thank you. All right, we've got another question here. What should I do to protect myself from flu this season? Dr. Perkins?
Again, the CDC recommends yearly flu vaccine for everyone 6 months of age and older as the first and most important step in protecting yourself and others from this serious disease.
All right. Okay. What should I do to protect my loved ones from flu this season?
Encourage your loved ones to get the vaccine.
I think we've got some repetition going on here. Very good. I think we're getting the message. Okay, so I guess there's no other questions here. We're about to conclude this webinar. Again, I want to thank everyone for their time. Oh, here comes one more question here. Let's get this one here. Okay, so our last question. Our hospital is experiencing a delay in our shipment for employee flu vaccines, FYI. Okay, so that's just an FYI, it's not a question. Okay. All right. So I want to thank everyone again for attending the 2018-19 seasonal flu webinar. We appreciate your time and your attention. Again, don't forget to follow us on Facebook and Twitter. Sign up for our digital updates. You go to our website at www.dallascounty.org/HHS. Click that red envelope in the upper right-hand corner to receive emails and or text messages to stay in the loop on flu information and public health information as well. I want to thank every one of our panelists here today that spoke and presented at our webinar, and I want to thank you all for joining us, and stay tuned for the next webinar. Thank you.